than 130,000 confirmed cases of COVID-19 and more than 2,000 deaths. Just announced out of Michigan, a state representative has died from the virus. New York leads the nation in the number of cases and fatalities, with more than 30,000 cases and nearly 1,000 people dead across the state. The city's Javits Center, transformed into a medical facility, ready Monday with 3,000 beds to receive patients not suffering from the virus, relieving hospitals. Governor Andrew Cuomo said the rate of hospitalization in the state is slowing, but warns the virus may not peak for another 2 weeks, telling all non-essential workers to stay home for at least 14 more days. And President Trump, who had aspirations to loosen restrictions by Easter, has now also extended White House guidelines.
Nothing would be worse than declaring victory before the victory is won. Therefore, we will be extending our guidelines to April 30th to slow the spread.
Dr. Anthony Fauci, the nation's top infectious disease expert, saying the U.S. could see at least 1 million cases and potentially as many as 200,000 deaths.
The number I gave out is, based on modeling. And I think it's entirely conceivable that if we do not mitigate to the extent that we're trying to do, that you could reach that number.
The president, after considering a quarantine of New York, New Jersey, and Connecticut, tweeted it won't be necessary. Instead, the CDC issuing a travel advisory to residents of the tri-state area. And other states now implementing strict measures to stop the spread. Texas announced a mandatory 2-week self-quarantine for travelers from several locations. And in Florida, long lines of traffic as checkpoints are used to enforce quarantines for anyone traveling from virus hot zones. Dr. Deborah Birx from the White House Coronavirus Task Force says they're studying New York closely.
What I wanted to be very clear on is every metro area should assume that they could have an outbreak equivalent to New York and do everything right now to prevent it. If they mitigate now, before they start seeing cases in the emergency room and in the hospital, once you see those, the virus has been spreading for days to weeks.
Good news for testing. The FDA has authorized a new coronavirus test that can deliver results in as little as 15 minutes. And makers say they expect to deliver 50,000 tests per day starting next week. Kenneth and Mona, back to you.
Andrea, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights,